Hey there friend, Christina here with NursingSchoolOfSuccess.com, and today's video is going to be pretty short and sweet because I just have one seriously awesome nursing school hack for you, and that is how to answer nursing school questions using what we call the ABCs. Now, I'll explain what the ABCs are in nursing in just a minute, because first, I really want to make sure that this is the right video for you. So, if you have been having trouble with answering nursing school questions on your exams, maybe you feel like you know the answer, but the exam question kind of tricks you up and you end up getting them wrong. Or if you get nervous when your clinical instructor asks you to prioritize patient care, then this video about the ABC nursing strategy will help you out. So this video is for you. And just a side note, if you are a Nursing SOS member, stop this video right now, go and log in to your dashboard and click on how to study. I've got a whole training video in the membership community for you that includes these ABCs, but it also covers all of the other test taking strategies that I recommend that you use in nursing school. So if you are a Nursing SOS member, head on over there, log into your dashboard, and find that training video. It will cover more than what we are going to cover here. So in this video, we are going to talk about the ABCs. Let's get to it. Okay, so the ABCs of nursing is just a handy dandy mnemonic for how to prioritize patient care and answer your nursing school questions right. So if you use it right, it's a really great nursing school hack because you will have a much easier time getting those nursing exam questions correct. So ABC stands for airway, breathing, and circulation. So those are the three top priorities when doing patient care, right? And when you're answering nursing school questions. You need to make sure that your patient has a clear airway, or what we call a patent airway. You need to make sure that they are breathing adequately, and you need to make sure that their blood is flowing and circulating through their body. So these are the three primary life or death physiological processes, right? If one of these isn't happening, it's game over, right? So that's why the ABC should be your top priority. So let's put this into action. If you get a case scenario on your nursing school exams, meaning that it's a question that walks you through a patient scenario or a patient situation, it might have you select the first or the initial thing or the immediate action that you would do. Now, here's where you should be thinking ABCs. I want you to walk through each of the answers listed for that question and see if any of those answers contain an intervention that keeps the patient's airway open, keeps them breathing, or keeps their blood circulating, right? The ABCs: airway, breathing, and circulation. So if you identify an answer like that includes the ABCs, go back, reread the question and make sure that the answer makes sense. And if it does, fantastic! You were just saved by the ABC strategy. So this strategy also works at clinical. You'll prioritize your patient care based on the ABCs. So if you have a patient who isn't breathing well or their blood isn't circulating as well, you'll most likely need to check in on them first or spend more time with that patient. So if your clinical instructor asks you what patient you will need to see first or why you planned your nursing care the way you did, just remember the nursing ABCs. So that is one of the best strategies to use for your nursing school exams and for your nursing school clinicals. Remember to prioritize the ABCs. Make sure that your patient's airway is clear, that it's patent, that they're breathing, and that their blood is circulating. Now, if you found this video helpful for you in nursing school, make sure to hit that like button, share this video with your friends that might also need help with prioritizing patient care or answering nursing school questions, and of course, hit that subscribe button and click the little bell icon so that you'll get notified when we post a new video here on the Nursing School Show. Thank you so much for watching, friend. Now go become the nurse that God created only you to be, and I will see you right back here next time on the Nursing School Show. Take care.